Hello and welcome to the Video Consultant. In this segment we'll discuss scrubbing your long-term care presentation language. Long-term care presentations are very sensitive discussions between advisors and clients. There are several words that can turn a very positive discussion into a totally negative one. Let's share a few words that we may want to replace in our language when discussing long-term care planning strategies. The first word is long-term care. Long-term care gives a person a vision of an old person in a nursing home. So instead of saying long-term care, let's use words like uninsured medical expenses, or extended care, or a post-retirement disability. I realize those are the same things as long-term care, but when it comes from your mouth, people tend to turn away and bury their head in the sand. The next thing that we tend to do is we talk about long-term care insurance as a pool of money. People can become very confused about pool of money concepts. You might want to consider words like long-term care checking account. That's very easy for a person to understand. Or if you're presenting a joint or shared policy, a joint long-term care checking account. Again, we want to use words and phrases that people can easily relate to when dealing with this risk. The other word maybe is elimination period that we would maybe want to replace with a word deductible. Most people understand what a deductible means. They do not understand what an elimination period means. Other words you may want to incorporate in your discussion are words like reasonable and meaningful. You want to make a plan that is reasonable to afford, and you want to put together a plan that is meaningful when they need the benefits. Many times we say words and phrases that take a totally positive approach and make it negative. And again, as we get closer to asking our clients to make a decision and execute a plan, these words become more and more important. If you would like to discuss presentation concepts such as these, feel free to call at 1-800-877-7006. Thank you for your time.